And welcome everybody to the Kiosk Presents here in Buffalo and Western New York. Today we have two very important guests talking to us about a super very important topic. It's Laurie, Fenton, Ambrose, CEO and President of the Lung Cancer Alliance, and Dr. Bill Mayfield, leading thoracic surgeon in Atlanta, Georgia. Laurie, Dr. Mayfield, welcome to the Kiosk Presents.
Thank you, Don. Glad to be here.
We've got some really bad news. The bad news is the 5-year survival rate for lung cancer is unchanged over the last 40 years. But you guys are here to tell us some really great news. Tell us all about it.
Well, Don, let me lead off with that because I know Dr. Mayfield will chime in. This is momentous. It's game-changing. What we can do now for those at risk for lung cancer, we've been doing for those at risk for breast cancer, for colon cancer, and other diseases. And that's find and detect and treat and cure the disease. This means tens of thousands of lives will be saved. It's game-changing.
How hard did you guys have to fight to get these rules changed? Because this is almost on a national level, or is on a national level.
Well, it is done a national level, no doubt. And we've been at this a long time. But the good news is that it's here, and it's overwhelmingly supportive. And the key now is making sure the public understands who could be at risk, and more importantly, where to go to have screening done well and right. And that's what atriskforlungcancer.org is intended to do, provide that supportive and navigatable information.
Well, you know, I don't think the average person understands what's the, I mean, a lot of people die. I read 160,000 people die of lung cancer this year alone. Where does that rank in terms of the leading cause of death in America?
So it's the leading cause of cancer death. Women will not relate to this, but it kills more women than breast cancer and cervical cancer and pancreatic cancer combined.
Wow.
It kills more men than colon cancer, prostate cancer, pancreatic cancer combined. It's just been this silent, stigmatized disease that people have basically ignored. Now it comes to the forefront because they have this very powerful tool to detect lung cancer very early with a low-dose CT scan, which uses less radiation than half of a mammogram test.
Wow, that's astounding. And it's just amazing. And it's going to save how many lives do you anticipate?
Well, the study, which focused on a narrow group from 55 to 79 years of age, reduced lung cancer mortality by 20%. Now, that was just in a study that had to be stopped because it was so powerful. So we're not sure what the numbers are going to be, but it could be 30%, 40% with early detection. 40% of 160,000 is 640,000 lives a year.
Wow, wow, what an impact. And doctor, the question I would ask you is, I know you mentioned that group, that age group, but who are the most at risk?
Well, this study defined that as the highest risk, and there have been a number of actuarial studies done as well. So 55 to 79 years of age with a 30-pack year history of smoking, that is 1 pack a day for 30 years. A number of our societies have endorsed screening at 50 years of age with 20 years of smoking a pack a day, and some other risk factors such as COPD, asbestos exposure, or some other disease.
I talked to a lady probably about 2 months ago, and she had lung cancer, and she never smoked. That just amazed me.
Yeah, and in fact, and it's a wonderful question because what is important to appreciate in all of this is that lung cancer is a disease. Sure, it has risk factors like every disease has. And in the case of lung cancer, over 20% of those diagnosed have never smoked at all. Why is that? What causes the genetic mutation? We don't know. We have not had the research directed to answer those questions. And I think it's also important to understand that beyond that 20%, 60% are former smokers, people who quit decades ago. So you have to consider that we now have one of the legs of our 3-leg stool of prevention, wellness, early intervention, and treatment research that can be brought to bear to look at lung cancer finally as the disease that it is. It is not a tobacco addiction alone. It's much more than that. And this is a good opportunity for us to move forward with a new day of support and compassion and hope.
All right, thank you for that, Laurie. Dr. Mayfield, another question. Men are so resistant to going to the doctors. By the time they start feeling symptoms from lung cancer, it's pretty serious and severe along the way, correct?
Well, correct. By the time you feel symptoms, then it's spread outside the lungs. It grows very silently in the lungs, and then by the time you can tell, by the time you feel it, it's moved into the bones or brain or something like that. The key to screening is that we can now detect lung cancer in its stage 1 and 2, where it's very curable. In our study, in our own experience of screening 1,100 patients, 80% of our patients were stage 1 and 2. That's compared to the people that walk in off the street, where 80% are stage 3 and 4. It's much safer and much less expensive to treat somebody with stage 1 and 2, and the cure rates are dramatically higher in 1 and 2.
Will family physicians now be recommending the low dosage CT scan to their patients, or should you go to your doctor and express concern, especially if you're in that risk group, and ask for it?
Right. We want you to go to your physician to consult with them about what your risk factors might be, and we want your physician to know who the providers are in your community that screen responsibly, and that is with low-dose CT scanning and a multidisciplinary team with thoracic oncologists, pulmonologists, medical oncologists, and radiologists who work together to interpret and treat those scans responsibly.
You know, what a wonderful thing. When I introduced you folks, I said, this is going to be an important interview. This is an important interview. And for people listening now, what can they do to assess the risk, or what can they do now to maybe learn more or position themselves better? Because I got to tell you something. The thought of taking a few preemptive steps and avoiding such a horrible outcome as dying from lung cancer when it was very preventable and treatable is, and maybe not preventable, but at least treatable and easy to diagnose in its early stages. What can they do to make sure they can take advantage of this new opportunity?
Well, Don, we couldn't have said that better than you just did. The bottom line, this is life-saving. It is cost-effective. Know your risk by going to atriskforlungcancer.org, and then use these resources to go to only places where care is being done responsibly. This is win-win. It's good.
All right, all I'm going to say to our viewers is, everybody, if you're smoking, stop. If you're not smoking, don't start. And definitely take advantage of this fantastic new opportunity to get early diagnosis on lung cancer. Laurie, Dr. Mayfield, fantastic having you here. It's been wonderful, and I appreciate all you've done and all you're doing.
Thank you, Don.